Call the Health Committee meeting to order. All members present, Les Kokenauer and McTaggart. The motion to approve the agenda. So be. For a second. It's been moved and seconded. Any discussion on the agenda? All in favor to approve the agenda, say aye. Aye. Opposed, same sign. Motion carries. Public comments. Hearing none. Agency reports. No one present.
I have this from Abra to pass around. This was to be distributed last month, but we didn't have a meeting. This is actually yours. I guess I wrote them all. That one's mine. Okay. They're the same. Thank you. This is just their quarterly report that they turn into us.
This is going to enter into the minutes now.
Yes.
Okay, everybody's got a copy of that. We'll go on to the Iroquois County Public Health Department report.
Good morning. Good
Morning.
morning.
Good morning.
We're going to go through the program summary report first, which is your count up for your programs. In June, Terry's Environmental Health did 44 food sanitation inspections. Only 2 permits were issued this past month, and he did 10 re-inspections. I just wanted to point that out because re-inspections are going to increase. Next month, I will bring, first of all, Thursday night at Board of Health, I will bring it, the ordinance for food service and sanitation to the Board of Health for approval. Then it'll come to this Health Committee next month for your approval because that's a county ordinance. The FDA food code, 2013 FDA food code that I brought to you last year was never adopted by the state, even though they kept saying it was coming, it was coming, it was coming, and they even had deadline dates. In the meantime, they got a new director for Food, Drug, and Dairies. Her name is Molly Lamb, and Molly decided that rather than adopt that 13 code, they'd wait for the 17 food code to come out. So the 17 food code, the FDA 2017 food code is out, and we have to adopt that by January 1st of 2019. So that we need to make some changes in our ordinance that go along with that FDA food code. One of the main differences that you'll see, and I'll go over this in detail with you next month, but is that all medium risk food establishments will now have to have a food manager at the establishment at all times. For some businesses, that won't be a problem. For other ones, that'll be a big problem. Places like, say, a local bar that serves cooks frozen pizza, that's a medium risk establishment, so they will have to have a food service manager, not just a food handler, on premises at all times. So that isn't something that the Iroquois County, that we're changing for our county. That's a state, that's the FDA food code. So actually it's nationwide. Excuse me. I got a tickle. And then there are some other, minor changes in there that I'll go over that with you next month, but I wanted to let you know that that's coming. So in the future, you're going to see more re-inspections because they're also reclassifying some of the inspection requirements. So you'll see an increase in that. It won't mean that we have more food establishments in Iroquois County, which I think is what people assume, or they assume that we're re-inspecting them because there was a problem. That may or may not be the case. So I just wanted to point that out. We are still doing free water sample testing for anyone with wells. I reported to you 2 months ago that at that time about 37% of our wells that we were testing were coming back with unfavorable results because, and we thought that most of that obviously was because floodwater breached the well. Well, that's correcting itself. We actually are seeing those well water retests come back very good. That's because most of the mitigation has been done by the well owner, the chlorination or whatever method they're doing to mitigate whatever bacteria was found in their well. And we still only have a couple that we're working with. But most of them got that taken care of, so that's a really good thing. But we are going to continue to offer free well water testing until they all come back good. I just think that's important. So when you offer it free rather than charge the $15, people tend to take advantage of that, and that's a good thing. We all want to make sure that our aquifer is protected. So last month we did 27 water well test kits. So we've done 180 so far this year. Last year, in the whole fiscal year, FY17, we only did 189. So we're already there, and we've still got August, September, October, November to go.
Right.
So we did 14 new well inspections this month. It tends to get higher in June, July, and August. Our numbers obviously do. He did 17 private sewage disposal inspections. We've taken 34 mosquito samples for West Nile surveillance. We have 6 sites set up in the county for those. They go every morning and collect the mosquitoes, and then you remember the presentation Eric did about how that testing process goes. So far, we have not had any mosquitoes test positive. That doesn't mean they're not out there, because some of the surrounding counties have. And then I sent a press release out here not too long ago from Siren. If you looked at the health department Facebook page, Illinois had its first 2018 human West Nile virus case, and that actually happened at the end of May. And in 2017, the first Illinois case wasn't until July. So it was about 5 weeks earlier than they expected, which we hope is not an indicator that it's going to be worse this year. So we hope that that's not an indicator. And that first case was actually not in southern Illinois, where temperatures tend to be warmer. It was a Chicago suburb. So it's interesting to watch those patterns. We'll be out at the fair during the fair with our health department booth, and we're going to be doing radon test kits, giving out free radon test kits so people can test their homes for radon. We're going to be talking about breast and cervical program and HPV vaccination and some of the things that we want to promote out in the community that are issues for people in Iroquois County. So we'll be doing that. Any questions with the environmental health portion of this report? So the next section is community health. We had 4 animal bite cases, 5 chlamydia cases, a hepatitis B case, 2 hepatitis C cases that needed investigation, a histoplasmosis case, a streptococcus pneumonia case that was invasive. That means somebody got strep and it turned into a pneumonia. 3 rabies investigations. Of those 3, 2 involved bats and 1 involved a dog. 1 bat came back negative, was able to test and came back negative. The dog tested negative, And then we had one where they weren't able to capture the bat. There wasn't a bat to test, so that person had to start rabies prophylaxis. And they did so willingly. And in fact, they didn't have a means of payment. They didn't have a medical card, they didn't have insurance. So we contacted the state and asked the state if they had some available funds, and they actually sent us the vaccine. So that was really nice, so it didn't become a cost for Iroquois County. We do have a line item in our budget specifically for that, but we didn't have to use it in this case. But it was very important. The private physician, family physician of this individual was adamant that they get it no matter what we had to do to get it. So that got taken care of. And they're completing the series.
So was this an outside bat or something why they couldn't get it, or?
The bat flew away after they bit the person.
Yeah, it was outside.
And the person was trying to catch the bat. And the bat was actually inside when it bit the person, when it was on the person's hands and bit the person, but then the bat got away. So, you know, if I had a bat in my house, I'd have every window and door open too.
Yeah.
So, you know, but it did get away, and we weren't able to test. So, do you have any other questions about those? We did a lot of TB skin testing this month. Look at the jump in the TB skin testing. That's because people tend to come in the summers for that, because that's when people need it for college registration, and people need it for schools, or if they're going to nursing school or a medical program or so forth. So that just, and some of that's our staff too. Which reminds me, I need mine. And then we had that huge jump. See the huge jump in hypertension screenings? That one of the reasons for that jump is because we attended the Prairie Sands Camping Club out at the fairgrounds and offered hypertension screenings for them. So that's what that number is so big this month for. And then if you go through the other ones, they're pretty much right along where they were. A little bit of an increase in the number of inmates assessed at the jail. You can see that. Any questions about the community programs? And then senior services, those numbers are pretty much right on track where they were. You can see that there was a kind of a jump in the nursing home pre- and post-screenings. A lot of people were needing screenings for that. That's a very important service. If we didn't have that at our health department, someone would have to come from a neighboring county. And there are only, for our senior programs, I'm not sure if you're aware of this, but for our senior programs, there are only 5 county health departments in the state of Illinois who offer the CCU program. So a lot of them are combined through other community organizations, and they cover multiple counties. So it may take a week to get a nursing home pre-screening done, whereas because we have that here in Iroquois County, we make sure that they are done within 24 hours of a request. So that's a huge asset for our seniors. Yeah.
Hey, where do you take the prisoners to be tested? Do you take them over to your office here, or do you do it right at the jail?
We go to the jail. We go to the jail every Wednesday morning, and then we go to the jail and do assessments on anyone who, they keep a list of any of the inmates that they know aren't going to be released, you know, make bail or released right away. And we do physical assessments, and we do health history on them, and we check over their medicines and all, you know, do a comprehensive assessment on them. And then we also see inmates for complaints. If they have a complaint, they see one of our nurses, and then our nurse makes a determination of whether they go see a doctor or not. And we do that. We will go over and do that anytime they call us.
What happens if one of the prisoners is a diabetic? What do you do about serum and stuff like that?
Yeah, they a lot of the prisoners have medicines that they take. So
they They do.
Yes.
So
So,
do they, a lot of them, do they carry their insulin, or do you have to provide it for them?
no, they provide all their own medicine. We don't buy their medicine for them, or we will help obtain it if they need it, you know. So let's say their prescription's expired and they can't refill it, then, you know, we'll make phone calls to the doctor, and we're kind of the one that makes sure that those needs are taken care of, but we don't pay for that, and we don't, you know, we just make sure that they get what they need.
Well, would the county end up paying for it, though?
Most of the time, the prisoners are responsible for that themselves.
I wonder how often they don't pay.
Yeah, I don't know that. That would be a question for
That's not a
Sheriff
statistic
Hagan.
for
Yeah,
you, huh?
yeah, I don't know. A lot of county, most county, I don't want to say all, but I think all, but at least most county jails have nurses that come and visit. Most that I'm aware of, like Ford County hires a nursing service to come in so that they have to pay for that service. We have always done it for free. I don't charge the sheriff's department for the visits. When we talk about this at administrators meetings down in Springfield, everybody looks at me like, you don't charge your sheriff's department? We just never have. I always think it's nice if we work together and play nice in the sandbox, and so no, we have never charged the jail for nursing visits, and I don't intend to do that anytime in the near future. It's something that we do, and we don't get paid for, and we just do it. There are lots of things we do that we don't get paid for, and we do because it's the right thing to do, and it keeps the citizens of the county safe.
That's good policy.
If an inmate needs a TB skin test, because when we go through the TB questionnaire, if they're having night sweats and coughing up blood, and, you know, if they meet that criteria and need a TB skin test, we do that for free, you know. We just do that. So I think we're probably one of the only counties, if not the only county in the state that I'm aware of that does it for free, but we're able to do that, so it's a county service, and we want to make sure that we keep the people who work at the jail safe.
Right. That's important.
Any more questions about the program summary report? No? Okay. So the next thing is your grants and contracts listing. I wish that all these columns in this last column for fiscal year 19 was filled out. And it should be, because the state grant fiscal year, this is for grants and contracts, okay? The state grant fiscal year started July 1, which was Sunday, so basically yesterday. So you would think we would have all these in place, right? Well, it's been like that for the last few years. We have a lot of grants that still haven't shown up in e-grams. I got, for example, we were told that the tobacco grant would be in e-grams on July 21st. Well, we're still waiting. I check every day, and we still don't have it in there. So public health administrators tend to make a lot of phone calls to each other. We have conference calls a lot. And everybody's in the same boat. So it's not just, you know, our county. We have a lot of grants out there. So because those grant periods started July 1st, yes, we are continuing to do those in good faith like we have the last couple of years, knowing that eventually we'll get that grant and then an agreement will, you know, be signed. But when you put in those grants, you write your grant application. It goes to the state. They will send me a confirmation that they have received the grant, usually right away, usually same day I get that confirmation. Then, because it's electronic, it goes through e-grams. Then it may take anywhere from a few weeks to a month, and then they'll send us a contract, and then I sign the contract, and then it goes back then for signature, and then they send it back to us. By the time all that happens, you're talking 3 or 4 months for most grants. But you're doing the grant in between, you know, knowing that you're eventually going to get paid for it. Yeah. Some grants will allow Sandy to do the billing, the grant billing. to the state. Without a contract number, and some won't. Most of them won't. Most of them won't. But it'll catch up. Okay? So, most of the grants through the state, and this is kind of a hard concept, because when people think of grants, they think, oh, you get this lump sum of money and you spend it, right? That is not how state grants work, okay? State grants, almost all state grants, you earn them, okay? So you're given a grant allocation amount. When we write the grant, first of all, I have to not only write, the project description and the goals and the objectives and go through all the grant deliverables and tell them how I'm going to meet those grant deliverables, but we also have to write a budget for each grant. Each grant has its own budget. Most of the grant budgets consist of, like a 10-page budget. So you've got your salary page, you've got your indirect cost page, like your benefits page, you've got your equipment, supplies, communications, different pages of what you're going to spend that grant money on. For most of the grant money, when we write grants, and I did this at the recommendation of Anita Speckman, who definitely knew what she was talking about when it came down, to writing grants and allocating monies. It is much easier to track, and it's a clearer path as far as the financials go and with the auditors. If you salary out most of your grant money, you use it towards salaries. And then our matching funds, most of our grants have a matching fund amount. So, like, for example, we may have a 10% match, where we've got to show that we're spending local dollars, tax levy, to match a certain amount of the grant for matching funds, and we use that for benefits, okay? And one of the reasons I tell you that is because, unlike the rest of the departments at the county level, the health department pays the benefits for all of our employees. We reimburse the county for all health insurance, for all of our staff, we pay our own unemployment, our own work comp, our own liability. So all the benefits that you pay for most of the county employees through the general fund, the health department pays those for the health department staff. Really the only benefit that I'm aware of that the county pays for health department staff is the IMRF. That's the only one. But the rest of, the county departments, it comes out of general fund, but it doesn't for the health department. We pay for those. We're able to do that. It's kind of like our contribution. So each grant has its own budget, and then those, we earn that grant money as we go along. So whatever I put into the budget, then Sandy will bill each grant. Some grants are billed monthly, some grants are billed quarterly, some are biannually. They're all different. She has to keep track of all that. And then she bills those salaries and equipment and whatever else. But the majority of our grants, we try to salary them out. Let me give you an example. So let's say Terry Iman is working on the, well, let's use public health emergency preparedness, because that one's a little different, and that's kind of one of our trickier ones. Public health emergency preparedness grant. Obviously, we're going to salary out of that grant allocation. You can look and see on this sheet what we got for that last year. Last year it was, and I'm using it for comparison because we've already got this year's. Last year it was $39,640. This year it's $39,205. The grant amounts, are going to continue to decrease. I don't think the state of Illinois is in a position where grant amounts are going to go up. I think if we think that, we're kidding ourselves. I think we're going to see them go down more and more and more, and eventually we're going to get to the point in the state of Illinois where there isn't money left, and we're going to see some drastic decreases, which is why our tax levy will be so important to us. It is important now, but it'll even become more important. So with that public health emergency preparedness grant, that grant we pay Eric's entire salary out of. we pay some of Terry Iman's salary out of, because he is the director over the environmental programs, and this is one of our environmental health programs, okay? Or it's in that domain, under that category. And then this is the only grant, 5% of my salary comes out of this grant. But that's the only grant that I'm written on as the health department administrator to claim some of my salary. I could write myself into every grant, my salary into every grant, but we run out of grant money on those grants before you get to me. By the time you pay the staff that actually works it, and then their director or supervisor, and by the time it gets to me or to Sandy's billing, or, there isn't any grant money left. What supplements that is the tax levy, and I'll talk to you more about the tax levy here in a minute. But for each grant, each grant has its own budget, and we have that process. But we start with salaries, and then we go to, and then there are certain grant deliverables that say that you have to buy certain equipment, or, every grant has its own set of rules. Okay? Some of our grants are from the Illinois Department of Aging, some of them are from Illinois Department of Health. If you look at deliverables on them, they're very different. We used to have DHS grants. We no longer have DHS grants, but that was WIC. WIC was our DHS grant with Family Case Management and HFI, and now those are a separate organization. But the grants are very different when you look at them from one granting organization to another. So it gets a little complicated, but we have to track everything for those budgets for every single grant. Okay? And then when I submit a budget to the Board of Health for approval, we take so let me start at the beginning for that, so that you understand. When you got everybody got one of these last month that talks about our annual report, and it talks about under environmental health which programs. You've got food sanitation, wells, septic, the Liquor Control Commission, Illinois Tobacco-Free Communities. You've got radon. You've got safe drinking water, solid waste inspections, tanning, vector. Tons of programs, right? So what I do at the health department to help me track everything and to keep a better sense of it is I break down the health department into these 4 divisions: administration, environmental health, community health, and senior services. And then all the programs that go underneath those 4 divisions, we count the grant revenue and our projected expenditures, and I make a page budget for that division. Okay? That rolls all together up into one big budget. Okay? But we've got to track it at a lot of different levels. So you've not only got to track it at the grant level, we've got to track it at the division level, and then at the health department level. It's a lot, and it took a long time for me as a new administrator to learn it. But once you got a nice process, and you have somebody wonderful like Sandy who tracks all that, because I am so blessed. We've never had a problem, and we get audited from every grant. You get audited, whether it's an in-house audit or a paper audit. We get an audit, and we've never had findings. We've never been slapped on the wrist. Very, very rarely do we even get questions. One of the ways to avoid that was to use it for mostly salaries, So and that's a good thing, because you can always prove that you had to pay somebody to do the job. So that leads us to Troy's question a few months ago, which was, what do we do with the tax levy? So if you look at this is page 14 out of this book. I just recopied it for you. I didn't figure you'd have your books with you. If you look at our summaries, if you look under revenue, and you split these up, you'll see that 35% of our revenue comes from grants and contracts. This grants and contracts list that I give you every month that we go over. And I tell you where we're at with that. So 26% is grants and 9% is contracts. Okay? 33% of our revenue is tax levy, and 32% is fee for service. So you're talking about 35%, 33%, and 32%. We are a third, a third, a third. A third of our revenue comes from the tax levy, a third of our revenue comes from fee for service, and a third of it comes from grants and contracts. Like I said, in the future, I don't think that the grants and contracts amounts are going to increase in Illinois. I just don't see that happening. So in order to understand how important that tax levy is, you have to understand these programs. So I just told you about these grants, right? And the grant budgets and so forth. In order to be, this is probably the most important thing I'll tell you today. In order to be a certified local health department, you are required to have certain programs, 6 different programs: food, water, septic, immunizations, communicable disease, and TB control. Okay, those are the 6 programs you are required to have in order to become a certified local health department. Now, to be a certified local health department, you also have to do community needs assessments and write this I-plan, and you have to show that your administrator is an approved administrator by the state and meets certain qualifications, and there are lots of things that entail certification. But those are the 6 programs you have to have. There are no grants for those programs. Okay? There's no such thing as a communicable disease grant, or a food sanitation grant, or a septic grant, or any of those things, okay? Those 6 programs are supposed to be tax levy supported, okay? That's the intent of the state. We do get a local health protection grant that we can use how we see fit in any programs, okay? But it's $65,434, so it's just a little supplement. And each county gets a local health protection grant. And that is the minimum amount, and we qualify for the minimum amount because it's based on population. And even though we're the 3rd largest landmass county in Illinois, our population is very small compared to a lot of counties. So our tax levy is used for those programs, those programs that we don't have grants for. Okay? Now, some of these programs have fee-for-service. So, for example, Terry Iman's programs, we charge people for a food permit every year. A food establishment pays $300 a year for a food establishment permit, which is required by law. He charges for well and septic inspections, those kinds of things. So that's where our fee-for-service money comes in. But when you get to community health, you can't charge people for a communicable disease investigation. You can't charge somebody because they had hepatitis B and we're trying to prevent you from spreading it to other people. There's no mechanism to charge people for a lot of the community health programs. So the tax levy, which last year you saw was a third. The tax levy was $316,000 for the health department. If we were at max tax levy, we would be at about $589,000. So we are right now, if I remember right, and I'm pretty sure this is correct, we're at 53.6% of our tax levy. We're one of the lowest in the state. Most health departments stay at max tax levy at all times. We aren't. I think our citizens are very fortunate. I think we've done a really good job of managing and trying to keep it as low as we can. Would I love to see the tax levy go down for everybody? Of course I would. I'm a taxpayer too. But the tax levy is needed for those programs that we don't have grants for, that you're required to have in order to be a certified health department. So we have to have a tax levy to protect people. Safe food, safe water, immunizations, TB prevention, that sort of thing. That's what your tax levy is for. So last year, so in the 2018 budget, that $316, I'm going to let you know exactly how I broke it down. Okay? So that $316,000 that we got for 2018 tax levy, I wrote into the budget that $84,453 would be used for administration. Okay? Sandy to bill. There's no grant, I mean, she can put some of her time on some grants, but, my salary, Cheryl's salary. Senior Services will be using $45,641 to keep our senior service programs going. And we may not, the income, because their numbers are going back up, may be better than I projected. So then if that is used for that, then it'll go into community health. By far, our biggest one is community health. Out of the 316, $170,721 is for community health. And those are the programs that keep everybody safe too. Mitigating communicable diseases, making sure that little kids in school learn how to brush their teeth properly, all the educational programs that we do, all the presentations that we go out and do, all the times we go out and do bloodborne pathogens trainings for every school district in the county that asks for it, all those things that we can't charge people for or choose not to charge people for. Because I'm a true believer that if somebody wants to be educated about a disease or a way to protect themselves, that we shouldn't be, charging them. And then the environmental health section only uses $15,185 because, like I said, Terry has all those mechanisms to charge fees. So his programs are pretty self-sustainable. So there's your $316,000. Okay. So that's what we do with the tax levy, and that's why we have a tax levy, and that's why your tax levy is important, but it is very necessary. Yeah.
Do you know, out of the 102 counties in Illinois, are there any counties that doesn't have a public health system?
There are two.
Do they share them with another county?
No.
How do they get by that?
Actually, one of them is now contracting with a neighboring county, but there is still one county in the state of Illinois that does not have a public health department. So what happens is their residents go visit, if they need services, go visit the other county health departments. And the surrounding county health departments do investigate those diseases.
Do they charge that particular county for any services?
I don't think so.
That's all free services
I think
to
that
that
they
county?
just do it because we all know that a disease doesn't stop at a county line. Right? It's not going to happen. And if they don't mitigate the diseases in that county, they will come to their county. I think you guys have a good understanding of this, but I still wonder all the time whether the general population has a full understanding of the work we do every day to keep them safe. If we weren't there mitigating some of these diseases, they would spread. For example, I think not too long ago I used a case where we had a meningitis case that was a bacterial case that was highly contagious. We went in to the rest of the family and gave them specific antibiotics so that they wouldn't develop meningitis. Had we not done that, that could have spread to the rest of the family and the neighbor. It could become a huge health threat. The little girl who had meningitis, in that case, passed away and died.
Well, I applaud you for knowing that statistic.
Yeah. Well, it's important. 2 years ago, when the state payments were so slow, remember, about 50% of the health departments across the state ended up having to either reduce their hours of service, reduce their programs, cut staff, and some of them even literally kind of shut down. Not for long periods, but a lot of them had to reduce staff. 50% of the health departments in the state did that. We did not. And we're not in a situation where that would happen to us if the state is slow on payments. We are financially secure enough to...
Even with our low population?
Even with our low population, we are financially secure enough that I have darn close to probably right about a 9-month reserve for us, which is pretty good. Most health departments don't have that. Ford County, if you remember, put a notice in the newspaper, so it was public knowledge 2 years ago. We will be closing our doors at the June 30th if the state doesn't have payments don't start coming in. Remember when that was in the paper? Mm-hmm. We were lucky that we weren't in that position. My staff knows I'm tight when it comes to spending money. I told our Board of Health when we started 4 years ago, we came to this building. When we moved here, we had $350,000. Our balance now is around $940. So I told them that I wanted to get to $750. Okay, that was the goal, because $750 would be a 6-month reserve at that time anyway. And the state recommended that we keep $750,000 in reserve in case you have a big TB outbreak. I've spoken to you guys about TB outbreaks, and I talked to you, remember one day, about what happened in Kane County, and it cost them $125,000 just in a little brief period, and then by the time their whole investigation of their TB cases was over, it ended up costing their health department $2.2 million. Because they ended up with 125 people who tested positive for TB and then had chest x-rays and became active TB clients. They had 125 active TB cases. That could happen in Iroquois County. We have to have money in reserve if that happens, because you have to mitigate that. You have to. Lots of counties, approximately 50% of the counties in the state of Illinois, actually it's 48% is the exact number, because I pulled it for Troy because he asked me months ago, 48% of the counties in Illinois still have a TB levy. We do not. Iroquois County does not have a TB levy. Years ago, the TB levy money was rolled over to the health department. So the health department has agreed to take responsibility for that using health department funds. So that's one of the reasons we keep our reserve. I am a little bit over the reserve, but I keep telling you that these grants and contracts are going to go down. So I don't see this wheel chart that I showed you now being the same even 2 or 3 years from now, unless something very drastically happens in the state of Illinois, and I don't see it happening. Do you? I mean, I don't see where Illinois is going to come up with a bunch of grant money. So I think this grant money is going to go down, which is going to make us a little bit more dependent on our reserves and our tax levy. So I probably will not ask the Board of Health or the county board to lower the tax levy this year. I will probably ask for it to remain the same. Because we have to plan for the future. I think to not plan for the future is irresponsible. I don't think it's a good idea to sprint down to zero all the time. I don't think we need to have a ton of money in reserve. I really don't.
Are your fee-for-services in line with the other counties?
Yeah, actually, they are. Troy, I've been looking at that. And one of the reasons I've been looking at that is because Terry's been talking about, he likes the idea of his programs being self-sustaining and not using any tax levy money, using the tax levy money for community health and so
Well,
forth.
there's also some fairness there, because obviously I don't have kids in school anymore, so I'm paying for things that
Sure,
I'm no longer using.
sure.
So fee-for-services, at least if you're putting in a new well, you're paying your own fee.
Yes, and right now, ours are pretty much in line with the other counties. The only thing that we probably aren't in line with, and I'm just going to be upfront with you, is the immunization charges. We're allowed to charge up to $23 because we also accept Medicaid and we have a contract with them. We're allowed to charge up to $23 for those vaccines. We charge $15. But you have to understand that when kids go to kindergarten, they need DPT, diphtheria, tetanus, pertussis. They need an MMR. They need a polio vaccine. They need chickenpox vaccine. That's 4 shots, okay? So $15 a shot is going to cost that parent $60 for that child. That's a lot of money for some people, and if we raise it to $23, that gets closer to $100. We try to keep it affordable for people so that it doesn't become a burden. We could always raise our fees, on some of these things, but I don't like doing that. I don't want to be a burden to the restaurants. I don't want to be a burden to, as far as their fees, to individuals. So we try to keep our fees as low as we can. right now I think I'm doing a pretty good balancing act. I'm only at 53.6% of our max tax levy. I think that's pretty good. I think if you look at the other taxing bodies that report to this health committee, most of them are at 100%. I think I'm the only one that's not. So we try to be fair. We try to be responsible. I think we do an excellent job at the health department watching our expenditures. I send people to the trainings that they need to. If it's not necessarily, they don't usually get to go. We don't buy random stuff. We don't give a lot of giveaways because that just costs the taxpayers more. And I'm not interested in having taxpayers pay for things, freebies that a lot of health departments do give away. I think we try to be as responsible as we can. You guys, if you know me and know me well, I don't like to spend other people's money. I don't have a problem spending my own money, but I don't like to spend other people's money. So, and the health department is, it's other people's money. It's the county taxpayers' money. Even the grants and contracts. The grants and contracts money comes from your state taxes. Okay, so that's still your money, and I don't forget that we work for the people. And
You're one of the few.
we try. Questions? I'll take any questions you want to ask.
Where do you buy your medicine?
Where do I buy my medicine?
No, for your shots and stuff like that.
Oh, mostly through the manufacturers.
Do you do your own buying?
Yeah, yes, Sandy purchases everything for us. Now, we do use a consortium.
Like a small don't want to say warehouse, but a supply house?
Yeah, sure, come on down and we'll show it to you. We have vaccine refrigerators, and we have some vaccines are frozen, so they have to go in a freezer, so we have a vaccine freezer, and then we have a big vaccine refrigerator. They're very complicated, very expensive pieces of equipment. In order to belong to the Vaccines for Children program, this equipment is very regulated and very monitored. That is why, when I reported to you, there for a little short period of time, we were the only one in the county giving vaccines, remember? It's because the equipment regulations put, the doctor's offices weren't able to, that was one of the reasons, and then obviously because if you're only going to get reimbursed $3.20 for a shot, an immunization shot from Medicaid, which leads me to something else, which I'll talk to you about in a minute. But we have a stockpile of all that, and we keep what we think we need on hand at all times. We try not to overstock.
Does some of those have shelf lives?
Yeah, yeah, they all have an expiration date. Every vaccine has an expiration date, yes. And they have to be kept within certain temperatures. So we monitor, our vaccine refrigerator has to be checked every morning and every afternoon, and the temperature has to be logged. We also have what's called a data logger inside of that. Inside of every freezer and refrigerator, there's a data logger. A lot of people don't know this, but that data logger drives me insane. It texts me every time there's a temperature excursion or every time that the cloud internet connection is broken. There are nights when I will, it used to call my phone, ring it. Now I have it set to text me. Because there are lots of nights I'm woke up because there's a thunderstorm and we've lost internet connection with the cloud, and I don't just get one text, I get a text for every one of our primary refrigerators and our backup refrigerator, our primary freezer and our backup freezer. So I get 4 texts every time the connection's lost, and then I get 4 texts when it gets reconnected. And sometimes it'll do that all night long, and there have been nights where I jokingly counted them with Vonda and had, 50 texts in a night. But I don't dare shut my phone off because I'm a public health administrator and I'm on call to the Illinois Department of Public Health duty officer.
The average Joe don't know
24
that.
hours a day. So
The average Joe don't know that.
no, people do. If people
And I
knew
got to tell you that I didn't know that either.
how hard we work and the things that we do and the regulations and hoops the government regulations and hoops that we go through to keep them safe, they would be impressed. People would have a true appreciation for public health. I have said this to you guys many times. The difference between a third world country and the United States is the public health infrastructure. People's health is better in the United States because of public health. The public health infrastructure in the UK kind of went, they appropriated less money to them over the last few years. You're seeing, you can get on the internet today and look, they're having measles and mumps outbreaks terribly. They didn't, every time that you try to decrease your public health infrastructure, you see people getting sick, So, what we do is important, and we keep people safe every single day. I was standing in Burkhart's about 2 weeks ago, and a lady tapped me on the shoulder and said that her daughter was working for a public health department in another county, and she never realized what they did for us, and she wanted to thank me for keeping her safe for so many years. Only because she had a daughter that had an understanding of what public health does. I've said this to you before, we don't advertise what we do. We don't put a lot of press releases out if there's an outbreak. We don't report what we're doing, a lot of it. First of all, because people have a right to privacy, okay? But second of all, it's not ever our intention to make the public afraid to go to Walmart or to make them afraid to go to a restaurant and eat. We shut down a restaurant not too long ago, and I had the press trying to contact me. I had people calling my house. I had neighbors calling my house. I didn't respond to any of them. First of all, if we've shut down a restaurant, you're going to know when it's safe to go back to eat because we're going to open it back up. If it's open back up, you can assume that we have done that, and they're now probably very safe to eat. But I never have an interest in hurting a business or hanging out people's health issues for public display. That benefits no one. Any questions? If you think of something later, call me.
No, I just have a comment on the revenue structure there. The tax levy. As those grants go down, that may appear, an easy place to get funding, but technically, if those grants go down, the services should go down because they're earmarked for that.
You're correct, Troy.
You know what I mean?
You absolutely are. There are some of them that are worth spending a little more in, and there are other ones that if the grants go away, the program goes away.
So if your grants go down, could you push on the contract side of things and get that one back up? To
Sure.
keep it at third?
And we'll push on the fee-for-service
And
side,
you could
too.
hold, well...
It's never going to be my
You gotta
intention.
be careful there because you can't, some restaurant, we can't run them out of town either.
No.
No, enough of that.
But the contract one, because that would fill the hole. on the
Absolutely.
grant side.
Absolutely.
Because the tax levy thing scares me about that. It's a one-way deal. When it goes up, it never goes down.
I understand that, and and Troy, I feel the same way you do. I really do. I like being at the 50%, basically a 50% max tax rate. I don't want to raise taxes on people. I'm going to do everything in my power to not ever raise taxes. I just don't want. I want the county board to understand what we do with the tax levy and why it's important, and not try to run us down to zero either, because it is important.
No, and the important thing is to look out ahead a little bit. That's what got all these other
Health
counties in
departments
trouble because it's no different than
It
this county with the real estate tax cycle. We've kind of lost focus that the money you collect is for the, it's not for now.
Right.
It's for the next year.
Right,
So
right.
you will run out if you use it.
Absolutely. So yeah, I'm try to be very careful about our expenditures. There's nothing. I've told every county board member and certainly the Board of Health knows this. I'm an open book. If you want to see our numbers, you come in. I will pull them. You can look at everything. You can see where we're at, what we used it for. I work for you, the public. If people have questions, come and ask me. I try to hide nothing and try to be honest and transparent. The problem with that is getting people to understand the importance of what we do and why it's necessary. But I think we're doing a better job of having people understand why public health is so important and how it makes a difference in every single person's life every single day.
Well, it was a very good presentation. I learned a lot today.
Good job?
Yes, I did.
Good.
Thank you.
Thank you.
Thank you.
Is there any old business to come before the committee? Any new business? If not, I would entertain a motion. It has been moved. Do I have a second? Second. Jed? All in favor to adjourn?
Aye.
Opposed, same sign. Meeting is adjourned.
Thank you, Dee.